Hello everyone, my name is Emily Kosick and I'm a Knowledge Manager for the Canadian Institute for Public Safety Research and Treatment. I want to welcome you all to today's session on the PSP Mental Health website. Before we get started today, there are just a few housekeeping items I want to go through. First, all attendees are in listen-only mode to limit feedback and noise. Second, today's session will be recorded. You'll be sent a copy tomorrow, so if you miss anything, you can watch it again. The GoToWebinar launch window can be blocked by some organizations, so if you're having trouble hearing or seeing, you may have to join us by phone. Lastly, we will be looking for audience questions at the end of the session, so please send us your questions through the questions box or be ready to raise your hand so you can ask your question out loud. Now, I'm pleased to introduce our speaker for today. Dr. Jill Price is a University of Regina researcher and the lead on the project that created the PSP Mental Health website. Also joining us is Dr. Amelie Fournier, a clinician with PSPNet, who has joined us today in case you have any questions that you'd like answered in French. I will turn over the screen sharing to Dr. Price, so give me 1 second here, and she will begin her presentation.
Okay, can you see it, Emily?
Everything looks good.
Great. There we go. Welcome, everybody. So my name is Dr. Jill Price, and I'm going to be discussing the website PSP Mental Health today. As stated, I'm a postdoctoral fellow at CIPCERT, which is located at the University of Regina. I have no relationships with commercial interests, and this project was funded through CIHR. I've also included my email here in case you have questions that you're unable to attend or ask at the end of the webinar. So public safety personnel, also known as PSP, is a broad term that encompasses personnel who ensure the safety and security of Canadians. PSP include, but are not limited to, border services officers, correctional workers, firefighters, Indigenous emergency managers, municipal and provincial police, operational intelligence personnel, paramedics, RCMP, as well as search and rescue personnel. Now, compared to the general population, the work of PSP consists of unique demands and stressors that increase the risk of exposure to potentially psychologically traumatic events. A potentially psychologically traumatic event is a stressful event that may cause psychological trauma. Events that are considered most problematic are typically unexpected and involve death or gruesome injuries, especially with vulnerable victims such as children. Most of the general population report exposure to one or more potentially psychologically traumatic event in their lifetime. However, in 2019, Carlton and colleagues found that PSP report exposure to 11 out of 16 different types of potentially psychologically traumatic events, as listed here in the left-hand column. Specifically, results show that over 90% of PSP report exposure to a serious transportation accident, physical assault, sudden violent death, and sudden accidental death. This is concerning because repeated exposure to potentially psychologically traumatic events can increase the risk for developing mental health challenges, such as a post-traumatic stress injury. To help address the impact of potentially psychologically traumatic events, there is a growing number of mental health support programs and services that are intended for PSP, the demand for which, of course, has been growing in the wake of COVID-19. However, many of these supports contain comparable material and deliver high levels of variability across agencies and provinces with little to no empirical evidence. In 2016, Bashai and Carlton conducted a systematic review. They found that while PSP appreciate having peer support and crisis-focused psychological intervention programs, there is little to no empirical evidence supporting or refuting the effectiveness of such programs. To help address this concern, a research team was assembled by Dr. Nick Carlton to evaluate this list of mental health support programs and services available to Canadian public safety personnel. Before beginning our evaluation of these mental health supports, the team decided to conduct an environmental scan to see if there were any other programs or services available across the country. We quickly realized that the list far exceeds this here. After nearly 2 years, I identified over 100 organizations that offer more than 280 mental health resources intended for Canadian public safety personnel. Now, as members of the Saskatchewan First Responder Mental Health Committee, we asked our colleagues how many of these supports they were aware of. Most said 1 or 2. Suddenly, the primary goal of this project changed. Before evaluation of these programs and services could occur, we acknowledged the importance of first distributing this list to the public safety community. To do so, we decided to create a free online repository, which later was named PSP Mental Health. PSP Mental Health was designed to provide a list of mental health resources to PSP and their family members. I want to be clear, however, that by providing the list of the research team does not endorse any of the programs or services listed on the website. Now, the English version of this website launched in June, but we're pleased to announce that the French version of this website launched in November. Now, when designing the aesthetic appeal of the website, we decided to keep the homepage nice and clean and simple. The last thing we wanted was for users who are in crisis to come to the website and feel overwhelmed. That way, it's nice and clean and simple, and there's just 3 tabs. If someone is in crisis, they can immediately click on Find Support and then be directed to the list of resources that we have. Or they can click on the About Us to learn more about the website, the research team, and so on, or contact us through the tab as well. If they click on the About Us icon, it'll take them to this page here. This page provides a brief description, as I mentioned earlier, about what the website does. It also clarifies what we mean by PSP and provides our disclosure. They can scroll manually through this page or click on the tabs above to jump to the different sections. If they click or scroll to meet our team, they'll see the list of researchers who are responsible for the development and implementation of this website. Now, while the project has grown exponentially, so has the assistance needed in this project. So we also want to acknowledge the list of growing members who helped contribute to this beyond this immediate team here. They can continue to scroll or click on the how-to video icon at the top. This will provide a video providing a short explanation about how to use the website, kind of a condensed version of this webinar today, just to help them with any questions they may have with the usability of the website. Lastly, on this page, they'll find the frequently asked questions at the bottom. This list of questions was developed by the research team as well as PSP stakeholders. We've also updated this list of frequently asked questions through questions or comments we received through the contact page since the launch of the English website in June. If they click the Find Support icon at the top right corner, it will direct them to the support page. This is where most of the traffic is taking place on our website. Here, users can select among 2 features, search and compare. Let's take a look at the search feature. This page will provide a list of all organizations in alphabetical order. Users can choose to scroll manually through the list or to make use of the features on the left. The first feature is a search bar, allowing users to use their own keywords to automatically update the list of organizations on the right. For instance, if they typed PTSD, all organizations that mention or pertain to PTSD or post-traumatic stress disorder will filter, and they will only show those ones. The second feature are the filters on the left-hand side, allowing users to select among the pre-designated keywords, which will also automatically update the list. Let's take a closer look at these filters. The research team carefully selected 14 pre-designated filters based on feedback from the PSP stakeholders. The first is accessible via. Is the resource, whether that's a program or service, is it accessible at the individual level, or is it only accessible at the organizational level? Cost. Is the program or service free, or is there a payment required? Declared specialization. Does it include content specific to Indigenous cultures or the LGBTQ+2+ community? You'll notice that we have some question marks next to some of these filters here. These are hover features when on the website. If you scroll over them with your cursor or click on them with your finger if you're using a phone or tablet, they will provide more explanation as to what we mean by that filter, hoping that it will help users better navigate the website. Delivery mode. So how is it being delivered? To date, we have identified programs and services that are being delivered through apps, audio recordings, through email, in person, online, through the phone, podcast, text message, and even one that's available through virtual reality. In the wake of COVID-19, the number of programs and services that are being offered online has grown exponentially as well. So we felt it was important to differentiate between asynchronous and synchronous. So we provided hover features for those particular features to help users identify the difference from what we mean by those two different delivery modes. Facilitator. So who is delivering the service? We've identified resources that are being delivered through chaplains, elders, peers, registered mental health care providers, as well as services that are simply self-help. Gender, we've identified services that are available to all genders, as well as some that are specific to men or women only. To date, we haven't identified any resources that are available to or specific to non-binary individuals, but when those services become available, we will implement that filter on the website. What language are these resources being offered in? So we've identified resources, whether they're programs or services, that are being offered in Cree, English, French, German, as well as Spanish. One of our most popular filters is the mental health focus. Oftentimes users are coming to our website knowing that they're experiencing certain mental health challenges, whether that be anger, anxiety, depression, or so on. However, sometimes we get users coming to our service and they're not entirely sure what kind of mental health challenge that they're facing. All they know is that they're experiencing distress. So we've included a link to the free self-assessment tools. This will take them directly to the free self-assessment tools on the SIPCERT website, in which they can use if they're interested in to help identify maybe what mental health challenges that they're experiencing, so that they can better select which resources would be most suitable for them. An important filter that we've included is privacy. This has been repeatedly expressed among PSP members, leaders, and stakeholders as an important feature among their need for service or programs. So we've differentiated between anonymous and confidential programs and services specific for those requests. Participants, so who is the service available to? Is it available to any public safety personnel, or is it only available to certain specific sectors? Or perhaps it's just available or not at all available to leadership members? Some services and programs are exclusive to the front line and exclude the leadership members from them, and some are specific. So we've included that as a separate option. As stated before, this website is also designed for families. So we've included 4 categories of families. Oftentimes, spouses are included in these programs and services, but children are not. And sometimes children are, but only if they're over the age of 18. So this is children of the PSP members. We've also included categories for Canadian Armed Forces as well as others, as these professions are oftentimes intertwined within the public safety community. Structure of support. So is it being delivered one-on-one, in groups, or in a self-help manner? Type of support. Now, although we are from a field of psychology, we want to ensure that users have the autonomy to select their preferred type of support. These types range from animal-based to medical cannabis to psychotherapy to spiritual resources. We're cognizant that not one type is going to help everybody, and in fact, rather a combination is going to be probably most successful for these individuals. So we wanted to ensure that they had the autonomy to select which would be most appropriate for themselves. We've also included those hover features next to each of them so that they understand exactly what entails each of these different types. When should it be delivered? So is the program or service only supposed to be delivered proactively, so before a crisis occurs, or is it delivered reactively, so during and or after a crisis has occurred? And lastly, where is it being offered across the country? So the purpose of these features is to help users find the most appropriate service for their needs. As they filter through the services, they can then look at some of the pre-designated filters on the right. So we've selected 3 of the most common pre-designated filters: cost, language, and privacy, for each organization to highlight. We've also highlighted whether a referral is needed for each organization. That way, users don't go through the trouble of selecting an organization and potentially their service, contacting them, and then realizing at that point that a referral was actually needed and they don't actually have one. We have also highlighted among this list whether the organizations are not-for-profit or for-profit. We're not stating that one is better than the other, simply providing that information to the users so that they can make the best decision for themselves. These blue icons here are hover features on the website. It will pop up a list of locations where it's offered across the country, so they can look exactly potentially what cities, not just what provinces it's located in. And then if they decide, you know, I would like to read more about this particular organization, they can click on the Read More button. So say they select our organization as SIPCERT. They can read more about it, and our particular service is the self-assessment tools. Instead of providing paragraphs of information again, we've laid it out in a table format. That way users don't have to spend lots of time reading to understand what is being offered. We've also included the contact information for each service and program below. That way they can contact the organization directly without having to navigate to their website. Or they can click on the website link below, which will take them directly to the service on that website. And then they can explore more about it. So that is the search feature. The other feature is the compare feature. So the compare feature will help users identify the similarities and differences between 2 mental health support programs and or services. Now, this particular feature was requested by several leadership members. And oftentimes we'll get phone calls, emails from these leadership members stating that they're being offered to different services or programs for their members, and they're not sure which is the most suitable for their needs. And so what we've done is we've created this feature which would allow them to select the organization and then the support, whether it is a service or a program, and then compare them side by side. For instance, if they wanted to look at the two different services being offered through PSPNet, the Wellbeing course and the PTSD course, and they're trying to decide which one would be most suited for them, whether this is at a leadership organizational level or at the member individual level. Immediately they would see that the Wellbeing course incorporates some material related to anxiety and depression, whereas the PTSD course does not. They may be able to also see that the duration of these services are different, the locations of where they're being offered are different, and the languages as well. Hopefully this way, by comparing them side by side, it will provide them with the information that they need to make the most informed decision for themselves or their members' needs. So now that we have successfully launched the website, the research team is maintaining focus on the empirical evidence of these resources. So here are two articles I just wanted to highlight. The first is has been completed by Anderson and colleagues in 2020. Similar to the blue paper that I highlighted earlier in this webinar, they found inconsistent evidence of the effectiveness of several programs and services developed and deployed to mitigate the psychological impact of the potentially psychologically traumatic events among public safety personnel. And most recently, Donata and colleagues conducted a systematic review in 2021. They found that resilience and multimodal programs that combine a variety of therapeutic and skill-building approaches appear to reduce modest, time-limited reductions in symptoms of general psychological health, depression, burnout, stress, PTSD, and anxiety, as well as promoting well-being, adaptive coping, and resilience. So together, these studies, among others, are providing foundational information for the beginning of program and service evaluations. Now, given the number of programs and services identified, to recall, we have currently identified over 280 mental health support resources, and we are constantly hearing about new ones every day. Given the number that we've identified, the task of developing and evaluating all of these resources is going to take a lot of time, and it's going to take a village to do so. But when ready, we will be adding a new feature to this page, allowing users to explore the empirical evidence evaluating these resources. Lastly, I wanted to restate how excited we are to announce the French version of the website and that it is launched, expanding access to Canadian public safety personnel and their families. And I have asked my colleague, Amélie, to attend the webinar for anyone that has any questions in French. So thank you for your attention, and we're happy to answer any questions at this time.
Okay, thank you so much, Jill, for your presentation. So I do open the floor to questions from anybody who has any. This has been a basic overview of how the website works, which was great. It's great to see how easy it is to use. So if anybody out there has questions, please go ahead and submit them through the questions box, or you're free to raise your hand, and I can unmute you and you can ask your question. We'll just give people a few minutes there. So Jill, I know that you had mentioned that that the website itself doesn't endorse any particular practice over another. Now, I know some of the original idea of the study was to be looking at different programs and their effectiveness. Is that something that you're still looking at doing?
Absolutely, yes. The most common type of service that we identified on the website is actually peer support. And so we've already begun evaluations of some peer support programs and services that are being offered. We're also looking at, the conceptualization and implementation specifically of that type of support. So evaluations have certainly begun, and we're not the only ones that are doing it. Numerous researchers across the country have already started, and like I said, it's going to take a team, and we can't be the only ones that are doing it. So we're constantly encouraging others to help with that task, and whether those are at the individual or the researcher level, or these specific programs and services can certainly evaluate their own services and resources as well.
I do have a question here. How do you feel this would relate to volunteer organizations such as Search and Rescue Saskatchewan?
Volunteer organizations. So these are not specific to employed public safety personnel. So it applies to those that are employed. It applies to volunteer-based, so volunteer search and rescue, or firefighters, whoever within the public safety community. It also applies to even retired public safety personnel as well. These services are available to a wide scope of individuals within that community.
When you started your project, you indicated that you'd only had you were thinking maybe 25 at max that you would have to look at. What do you think has caused this kind of growth to be at over 200 services that you're looking at?
So initially, when that list was developed, the researchers were only looking really at programs that were being offered. And there's a difference between a program and a service. A program is something that's being implemented within like a PSP entity. Like, for instance, we're located in Regina, so a program perhaps being implemented within the Regina Police Service. There are, after we started this environmental scan, far more services than there are programs. And so by including services such as, equine therapy and like these peer support services that extend beyond programming, we were able to expand that list tremendously.
Did you just have a comment from one person indicating that there's so much more available considering what they started out with in 1988? So I think we can definitely see that, right?
Yes, absolutely. And like we said at the beginning, that even asking these public safety members how many they were aware of, and many of them to this date still don't know that all of these exist. We knew that this was our top priority with this project was getting that information out there so that people could seek out the resources, because you have to know that the resources exist before you're even able to access any of them. So we wanted to spread that knowledge far and wide as quickly as possible.
Which is ideal with this website. I think it's a really great resource in that way. So I will just let people know that they have a couple more minutes to go ahead and ask questions. I'm just wondering, Jill, if you can elaborate a little bit about how the website kind of, why it was designed the way it was for the user.
Like aesthetically or the functionality of it?
The functionality.
The functionality, we really wanted users to have control in what they were selecting. And so because there are so many different organizations, just having a list available might be too overwhelming and deter people from seeking out these mental health resources. So we really wanted them to have the autonomy and then be able to narrow down what's available to find what's most suited for their own needs. And because, as I mentioned, there's so much variability in what's being offered, it was really important for us as researchers to also have those filters, because it helps us see any kind of missing links or voids being forgotten within these resources. So the way that we developed it was to create these filters so that they had that way to filter, just like any other kind of website searching features. So
another quick question for you: how did you collect all the information on all these providers, all the services, the costs?
That's a great question. So as I said, it took me about 2 years to do so, and it was a tedious task. So it started out with collecting a list of organizations that we were already aware of, and then creating a list of the programs and services that they offer. Once I did that, we expanded the search to the internet with keyword searches to see if there was anything else or online that we could find. And then a lot of it also came from word of mouth, discussing with these providers. And they would indicate, you know, have you heard about this one? This one's a colleague of mine. Have you heard about their service? And then you would reach out. But in order to collect all the information, I had to call and have conversations with every single one of them individually. And these conversations happened numerous times because initially we were just collecting basic information like what language is it offered in, who is it available to, where are you located, to us deciding, you know, we should identify what type of service, you know, who's delivering it, what's the structure. So it was repeated phone calls and emails with everybody on the list. And we appreciate the cooperation of every single one of them, because without their cooperation, this would not have been a success.
You've spoken a little bit about it, but will there be ongoing evaluation of programs on your website or the resources to keep or remove them based on best practices from CIPSRT, like peer-led, psychologist-supported, evidence-based?
Yeah, so there's constantly, we're constantly adding new research to the CIPSRT website. For the time being, that is going to be our primary source of research related to the empirical effectiveness of these programs and services until we get more funding to develop the website to include that new feature of empirical evidence. So that's likely years down the road, unfortunately, at this point, unless we suddenly get our hands on that village to help us with it. But people looking for articles and journals related to these the empirical effectiveness should seek out the resources located on the CIPSRT website for the time being.
Do you think that once, if a program, let's say, had a number of empirical articles that had been put out through CIPSRT, if there would be discussion about removing something if there just was no evidence for it?
That's a great question. For the time being, what has been discussed is, well, we actually haven't even gotten there. We haven't gotten there to make that decision, but the last thing that we want to do is have a service or a program up on the website where users are now seeking out those resources if we know it's going to be harmful. So although the decision has not entirely been made by the team, I foresee that if a service or program shows to be harmful to these individuals, that we certainly wouldn't be having it on the website anymore. But I can't speak to that yet because we haven't come across that challenge just as of yet.
What are the plans for future for adding new programs that are always coming out? What's the process for adding these programs?
Right, so we are working on a partnership with another organization that will help us with the maintenance of the website. Because this is quite a task, we are constantly hearing about new ones, and we want to be updating the list as quickly as possible. We just do not have the means or the funding to do so as of yet. So any services or programs that aren't currently on our site, we encourage people to use the contact page on the PSP Mental Health website to contact us and inform us of ones that they believe are missing from the list. We are keeping a tally of those ones so that when we get the funding available to maintain the website, we can then hire the respective individuals to then update it. For those that are wondering whether or not, or when the website and that list has been last updated, you can find it on one of the frequently asked questions on the About Us page. So you can see when the last time that list has been updated. Because we've been working on the French version, the website we haven't added any new programs or services actually since the launch this summer, but we plan to do so hopefully in the new year, so stay tuned.
And I would like to precise that now PTSD course is also available in Quebec, so that's one of the examples that
needs to be added. Okay, so now someone had asked, and you've kind of spoken to this a little bit, but there's no vetting process for adding any new programs to the website. It's just about getting the information out there at the moment.
So there was there's a mild vetting process. That vetting process is that it has to be available to Canadian public safety personnel and or their families. Other than that, we're not classifying any services as better or worse and then deciding that one would be better suited or not. So we're including them if they meet all the needs and related to public safety personnel at this moment, yes.
All right, like I said, I'll give a couple more minutes for any other questions. Is there anything else that you wanted to add, Dr. Price?
Nothing at the moment, other than we're just really excited to have this website launch in French. If anybody does have questions, Amelie is here to answer those questions. If not, feel free to check out our website. I've included my contact in the webinar as well. It's jill.price@uregina.ca in case anyone wants to send me any emails following the webinar. I'm happy to answer those questions then as well.
All right, so we will just look at wrapping up here pretty quick, but I just wanted to thank both Dr. Price and Dr. Fournier for being here today and for everybody in the audience for asking great questions and learning more about, joining us to learn more about this wonderful website that provides all these great, easy to access ways to look at services. Like everybody else, I'm sure that I look forward to the empirical research that's going to follow from this. I know it's one of those tricky things where it takes years to get that research, but the services are so important to get out now for people that need it. So to both of you, I want to thank you for your work in this field. To everybody in the audience, I just want to remind you that this has been recorded, so it will be posted. You'll receive an email tomorrow with a link to the recording. We also will be hosting our next town hall on December the 9th, and it's titled Implementing Workplace Mental Health Interventions in Public Safety Organizations, and that's with Dr. Megan Edgelow. So she'll be talking to us about her research on how mental health interventions are implemented in public safety organizations. Again, thank you so much for being here today. Everybody in the audience, take care and stay safe.